Social isolation is a major risk factor for older adults. Mortality increases of about 30% in case of social isolation or loneliness. During crises, like heat waves or COVID-19, social isolation played a key role in increasing the number of deaths. The increase of older adults requests a radical change in our approach to prevention and care. Today, there is strong pressure to expand residential care, which has been proven ineffective and expensive. Municipalities across Europe should be interested in promoting a care model based on the involvement of the communities. Long Live the Elderly is a community-based proactive monitoring program addressing people aged more than 80. Older adults are about 90 million in Europe. They are the main users of health and social care. In many cases, they access health service too late when prevention is no longer possible, and care is long, expensive, and with limited effectiveness. The program builds up networks able to increase the social relationship and reducing loneliness among the older adults. It is based on periodic phone calls, home visits, individual care plans for frail older adults, which encompass several interventions. From advice on how to rearrange the houses to prevent falls, to the organization of care pathways, or the proposal to be included in socialization activities. The network of relationships is enriched by a number of volunteers who help to overcome social isolation with their friendly presence. Most of them are elderly themselves. Community nurses participate in the program, especially in implementing prevention interventions and contacts with GPs, and by promoting social and healthcare integration in the field. An intensive campaign about the risk of social isolation is needed to increase trust among the population in the area of action. The program has been able to contain mortality during heatwaves and the COVID-19 pandemic among people aged over 80, as well as reducing hospitalization and institutionalization rate. The savings range between 3 and 12% of expenditures for the standard of care. Based on these results, we propose to expand the program to other European municipalities. There are two ways. The first one is that municipalities take over the program. We offer the know-how, the training, and the supervision. Community of Sant'Egidio is no profit organization, therefore the aim is to finance the program replication at expenses that allow compensation for our personnel to follow and support issue. Expenses include the access to the software that supports the whole program, which can be connected to other IC platforms like the ones for telemedicine. The second is to secure private funds and implement the program directly through a formal agreement with the municipality. Both modalities currently ongoing in the field. The cost of the program is about €100 per person year. The cost of avoiding an unexpected death requires an investment of about €40,000 per year, significantly less than the WHO threshold for cost effectiveness for an intervention in Europe. We expect to find out funds to implement the first phase of the program, first implementation, in further EU cities.